The next several slides is going to talk about your diet progression after surgery. So go ahead and get out your handout on, it says post-bariatric surgery diet. And so that handout is going to go, there's several good suggestions on the front page on just tips and tricks, and then no's for your liquids. And then each page will have a description of what that stage is, on what types of food that you should tolerate well. There's a column for that, and then there's a column for things that maybe you should avoid. Then there's a column for suggested volumes and limits. Definitely take it serious on the limit. Now, when we suggest a volume, that is a suggestion. So if you're not able to fit it all in, don't push and don't overeat to try to meet that limit. Everybody's going to be a little bit different on what they can do. And so just be slow and patient with yourself, and do the best you can. So when we talk about your volumes on what you're supposed to be doing, that is... think of a measuring cup, measuring spoon. It's a volume, not a weight. And so measure like that through the whole stage. That's how you're going to figure out how much food you should be eating. And then think about texture. So each stage is kind of building a little texture. Remember earlier I talked about how you would advance a diet for a baby. You start thin and then increase the texture. And so that's what you're going to do with your new tool. You're going to just be slow and take care of it. So no bits and chunks of food until Dr. Jones says. You'll be able to do on the full liquid maybe like soft bits of food, but absolutely no meat until he tells you you can do meat, okay? That's going to be a harder one to chew and a harder one to get to pass through. And so... also remember, food choices are important. Just because you had surgery doesn't mean that that's gone. And so try to remember 90% of the time, make a good food choice. So avoid fried foods. Obviously baked is going to be better. Baked, grilled, broiled, that sort of thing whenever you talk about meats. Vegetables are always a good option. Try to limit your saturated fats, try to limit your sugars. Definitely a balanced diet. Carbs are are fine, but they're gonna make you hungry and they're gonna make you have cravings, so pick them wisely. Choose vegetables, choose things that are gonna provide you with some nutrition, and you're gonna be successful. Definitely read through the diet, like I said, in each of these slides, because you're going to pick up different pieces of information. If you have a question about the diet, you have access, or you have my contact information, you have the dietitian's contact information, you have Dr. Jones' office contact information. So definitely no stupid questions. The dumb question is the unasked question. And so definitely we're here for you.